You were not born anxious. Something changed. And if you think carefully about when the anxiety started, really think about it, there was almost certainly a period before it that you can name. A time when the low, persistent hum of worry was not the background to every morning. Most people who develop anxiety after 65 are told one of two things: that it is part of aging, or that they need medication. Neither of those answers asks the more important question: what changed in your body that is now producing the anxiety? Because anxiety after 65 is not a personality trait that arrived with age. It is a symptom, and symptoms have sources. In this video, I am going to show you 4 specific, measurable, and addressable sources of anxiety in the aging body, none of which require medication to address, and the natural interventions the research supports most clearly for each one. These are not breathing exercises and mindfulness tips. These are physiological interventions that target the biological mechanisms producing the anxiety. At around the 9-minute mark, I'm going to tell you something about one of the most commonly prescribed medications for anxiety in adults over 65 that you have almost certainly never been told. Something that should be part of every conversation before that prescription is written, and that isn't. I have spent more than 3 decades in geriatric medicine. Anxiety in older adults is one of the conditions I see most consistently undertreated in its actual causes and overtreated with medication. The research on what drives anxiety in the aging body is clear enough and specific enough to be translated directly into what you can change. That translation is what this video is. Let me give you the frame. Your nervous system has 2 modes: the sympathetic mode, the alarm system, the fight or flight response, the state of activation and vigilance, and the parasympathetic mode, the rest and recover state, the calm, the regulated and connected feeling of a body that is not under threat. In a healthy nervous system, these 2 modes balance. The alarm activates when there is a real threat and deactivates when the threat passes. In a body with persistent anxiety, the alarm is stuck. Not because the world has become more threatening, but because the body is receiving ongoing signals from internal sources: the gut, the hormones, the nervous system, the social environment, that it interprets as threat. The alarm fires because something inside the body is telling it to fire. The goal of a natural anxiety intervention is not to silence the alarm. It is to address the signals that are triggering it. There are 4 of them in the aging body that the research identifies most consistently. The first is gut dysbiosis and the loss of GABA-producing bacteria. GABA is the brain's primary calming neurotransmitter. It is the chemical signal that tells the nervous system to reduce its activation, to step back from the alarm state, to rest. When GABA is available in adequate quantity, anxiety reduces. When GABA is insufficient, the alarm system runs without adequate counterweight. Here is what most people, including most physicians, do not know. Approximately 90% of the body's GABA is produced not in the brain but in the gut by specific species of gut bacteria, primarily within the lactobacillus family. Those bacteria produce GABA from the dietary amino acids available to them, and they deliver it through the vagus nerve, the primary communication highway between the gut and the brain, as a signal that reaches the brain's own GABA receptors and reduces neural firing. In an older adult with a disrupted gut microbiome, reduced lactobacillus populations from antibiotics, from proton pump inhibitors, from a low-fiber diet, from age, this GABA-producing function is compromised. The gut is producing less of the molecule the brain needs to maintain calm. The alarm system runs without adequate suppression. This is not a theoretical relationship. Multiple human studies have found associations between gut microbiome composition and anxiety severity, and interventions that specifically restore lactobacillus populations through fermented foods and targeted prebiotic fiber have shown measurable reductions in anxiety markers in older adult cohorts. The second source is magnesium deficiency. Magnesium is one of the most important minerals for nervous system regulation, and it is deficient in a very high proportion of adults over 65. The reasons are multiple. Aging reduces gut absorption of magnesium. Many common medications deplete it: diuretics, proton pump inhibitors, certain antibiotics, and the modern diet is lower in magnesium-rich foods than it was several decades ago. Magnesium functions as the body's natural regulator of NMDA receptors, the glutamate receptors responsible for neural excitation. When magnesium is adequate, it sits in the NMDA receptor channel and blocks excessive firing. The nervous system is regulated. When magnesium is low, the channel is open, Glutamate drives excessive neural excitation, and the result is a nervous system that is chronically over-aroused. The clinical presentation of magnesium deficiency in older adults is anxiety, irritability, muscle tension, and poor sleep. Symptoms that are almost universally attributed to age or to psychological causes rather than to a mineral deficit. The deficiency is measurable with a simple blood test. The intervention is dietary and supplemental. Yet it is almost never the first thing checked when an older adult presents with anxiety. The third source is circadian disruption and chronic cortisol elevation. Cortisol, the body's primary stress hormone, follows a precise circadian rhythm. It rises sharply in the morning to prepare the body for the day, falls through the afternoon, and should be at its lowest at night, allowing the nervous system to enter the parasympathetic rest state. This rhythm is essential to anxiety regulation. A body that cycles correctly through cortisol, high when needed, low when it should be, can manage stress without accumulating it. In an older adult with disrupted circadian rhythms, from irregular sleep timing, from excessive evening light, from fragmented sleep architecture, this cortisol cycle flattens. Evening cortisol does not fall as it should. The nervous system does not fully enter the parasympathetic state. The body carries a background burden of stress activation that it never fully resolves. This is not ordinary stress. It is the physiological state of a cortisol system that never fully resets. And it presents as anxiety, a persistent background activation that cannot be explained by circumstances because its cause is not circumstances. Its cause is a disrupted hormonal clock. The fourth source is social isolation as a physiological stress state. This one is the least discussed and the most underestimated. Social connection is not simply an emotional need. It is a physiological regulator. In a socially connected body, a system called the social engagement system, driven through the vagus nerve, keeps the sympathetic nervous system in check. Social interaction, eye contact, warm conversation, shared physical space. These activate parasympathetic pathways that reduce cortisol, lower heart rate, and calm neural firing. In social isolation, which affects a significant proportion of adults over 65 following retirement, bereavement, or reduced mobility, this regulatory system loses its inputs. The body's parasympathetic anchor is removed. The alarm system, without the counterweight of social engagement, runs higher. The result is an anxiety that feels psychological, but is physiologically driven by the absence of the social signals the nervous system depends on for regulation. I want to tell you about a patient I worked with. No name, because this story belongs to many people. They came to me at 72 with anxiety that had begun following the death of their spouse 3 years earlier. In that time, they had been prescribed lorazepam by their primary care physician, a benzodiazepine, intended for short-term use. They were now on their second dose increase and were taking it daily. Their anxiety had worsened since starting the medication. They had had a fall 6 months earlier. Their memory had declined noticeably. Their sleep was fragmented, and they told me they felt worse than they had when the anxiety began. When I looked at the full picture, 4 things were present simultaneously. Their gut microbiome had been disrupted by a 2-year course of a proton pump inhibitor, with a single antibiotic course in between. Their serum magnesium was low. They were also on a diuretic, which depletes magnesium continuously. Their circadian rhythm was severely disrupted. Television until midnight, bright LED lighting throughout the house, 3 a.m. awakenings that had never been investigated. And following their spouse's death, they were living entirely alone with fewer than 4 meaningful social interactions per week. All 4 sources were present. None of them had been addressed. The anxiety had been medicated for 3 years without anyone asking what was producing it. Now, the 9-minute mark. The medication prescribed for that patient, lorazepam, belongs to the class called benzodiazepines. Xanax, Valium, Klonopin, Ativan, Restoril. These medications are prescribed for anxiety, for sleep, and for muscle relaxation in millions of adults over 65. They are on the American Geriatric Society Beers criteria, the formal evidence-based list of medications considered potentially inappropriate for older adults. They are there because of a combination of risks that is specific to the aging body, impaired cognition, significantly increased fall risk, and a phenomenon that is almost never discussed in the prescribing conversation: paradoxical anxiety. In a meaningful proportion of older adults on long-term benzodiazepine use, the medication produces increased anxiety rather than reducing it. The mechanism involves the brain's GABA receptors down-regulating in response to chronic pharmacological stimulation. The receptor count and sensitivity reduce over time, and the anxiety baseline rises. The patient experiences more anxiety than before they started. The dose is increased, the receptors downregulate further, and the cycle continues. This does not mean every person on a benzodiazepine is experiencing this, but it does mean that if you have been on one of these medications for more than several weeks, and your anxiety has not improved or has worsened, the medication itself belongs in the conversation about why. That conversation requires your physician. Benzodiazepines cannot be stopped abruptly. The taper must be medically supervised. But the conversation about whether long-term use is appropriate and whether the four sources I have described might be addressed before or alongside any medication decision is one you are now equipped to start. The four sources of anxiety I described are not permanent. They are conditions, and conditions can be addressed. 3 things, starting this week. The first is the gut-GABA protocol. Add 1 daily serving of fermented food, yogurt with live cultures, kefir, sauerkraut, kimchi, to specifically support lactobacillus populations. Simultaneously, add inulin-type prebiotic fiber, found in leeks, garlic, asparagus, and Jerusalem artichokes, to feed those populations. The gut does not rebuild overnight. It responds over 2 to 4 weeks of consistent input. Expect gradual, not immediate change, and note what you observe at 2 weeks. The second is the magnesium conversation. At your next appointment, ask your physician to check your serum magnesium level. If you take a diuretic or a proton pump inhibitor, there is a high probability it is low. Dietary sources with the highest magnesium content: pumpkin seeds, dark chocolate at 70% or above, avocado, spinach, and legumes. If supplementing, magnesium glycinate and magnesium threonate have the strongest evidence for nervous system effects. Discuss the appropriate dose for your individual situation with your physician. The third is the vagal tone daily practice. The vagus nerve carries the calming signal between the gut and the brain, and its tone, its strength and responsiveness, can be directly increased through specific daily practices. 3 that have the strongest research evidence. The physiological sigh, which is a double inhale through the nose followed by a long, slow exhale through the mouth. 5 repetitions reduce acute anxiety within 90 seconds in controlled studies. Humming or singing, which vibrates the vagal nerve directly through the larynx and has been shown to reduce cortisol in multiple trials. And consistent social engagement, at minimum 3 meaningful face-to-face or voice-to-voice interactions per week, which activates the social engagement system of the vagus nerve and provides the parasympathetic counterweight the nervous system depends on. Go back to where this video began. You were not born anxious. Something changed. 4 things, most likely, gradually, and without anyone naming them or examining them. The gut, that no longer produces the calm signal it once did. The mineral that is slowly being depleted by a medication no one connected to your mood. The cortisol clock that never fully resets because the evening never properly quiets. The social nervous system that has lost the inputs that kept the alarm from running continuously. These are not inevitable. They are addressable, and you now know how to address them. If someone you care about has been living with anxiety, they were told was just part of aging, or is on a medication for anxiety that they have been on for years without improvement, please share this video with them. Because the conversation their body needs them to start is not with a pharmacist. It is with the 4 sources this video has named. Tonight, before you sleep, I want you to try one specific thing. It takes 60 seconds. Take a slow breath in through your nose for a count of 4. Then exhale through your mouth for a count of 8. Do this 5 times. That extended exhale directly activates the vagus nerve. Tomorrow morning, before anything else, notice how your body feels when you wake up. Specifically, whether the anxious quality of the morning, the background activation that many people experience before the day has given them any reason to be anxious, is even slightly different from usual. Write down 1 word to describe what you notice. Because next week I'm going to give you the complete vagal tone rebuilding protocol, 7 specific practices ranked by research strength that address the physiological roots of anxiety in the aging body. Come back with your 1 word. 1 important note before you go. Everything in this video is for educational purposes only and is not a substitute for the guidance of your personal physician. If you are currently taking a benzodiazepine or any other medication for anxiety, please do not stop or reduce it without medical supervision. Benzodiazepine tapering must be carefully managed by a physician. If you are experiencing severe anxiety, panic attacks, or any mental health crisis, please reach out to your healthcare provider or a mental health professional. The interventions in this video are designed to address physiological sources of anxiety and are appropriate to discuss with your physician as part of a comprehensive approach to your care.